Welcome to the second part of Trichomonas vaginalis. In this section, we will discuss about the life cycle, its virulence, and also we will discuss about what are the treatment factors and complications associated with it. Now, discussing its life cycle is quite simple and it's completed in a single host, either it is a male or a female, so it doesn't need a second host. In females, the parasite do gets its nutrition from the vaginal mucosa, ingested bacteria, and RBCs. The type of reproduction that it shows is a binary fission, where the division of nucleus is followed by the division of neuromuscular apparatus and separation of cytoplasm into two trophozoites. As we have discussed, that trophozoite is the only form of Trichomonas uh, morphologically present in the entire life cycle. These trophozoites are the infective stage and they can be communicated to other person through sexual contact. Trophozoites are transmitted to male and get localized in the urethra and prostate gland, and they replicate in the same way. So it's a sexually transmitted disease, Trichomonas vaginalis. It not only affects females but also males. Usually, vaginitis is not only associated with Trichomonas vaginalis. It can be due to some other uh, organisms like bacterial vaginosis. Uh, it's caused by some anaerobes and Gardnerella bacteria. Trichomoniasis, so that is due to Trichomonas vaginalis, accounts for around 20% of cases, and candidiasis, albicans, that is approximately this one is a fungal infection which results in around 25% of the cases. So, in case we are encountering vaginitis, it's not only that you should be keeping in mind an infectious agent like Trichomonas, but we can also consider certain bacteria and fungi which are responsible for this. Now, its pathogenesis and the pathology that it causes. It is a non-invasive parasite, so it doesn't invade into the deeper tissue. It usually remains adherent to the squamous epithelium and not the columnar epithelium. Now, what decides its virulence factor? It's obviously the surface molecules which help in binding with the epithelial tissue, the protein, liquid, and proteases, and lactic acid and acetic acid, which lowers the vaginal pH, and low pH is cytotoxic to vaginal epithelial cell. Again, enzyme cysteine proteases, which is known as CP39, we should keep this short term in mind, is responsible for hemolytic activity of the parasite. This is one of the enzymes which plays a major factor in establishing the pathology associated with vaginitis. So what we find here is that due to low pH and other activities of enzyme, is causing hemolysis, there's a chicken-like epithelium, and is the most characteristic feature associated. That is an intracellular edema, which gives an appearance which is known as chicken-like epithelium. Now, how does this occurs? As you can see, this diagram, the three elliptical structures showing ligands on them is actually the vaginal epithelial cell. And these ligand receptors, cytoadherents, they are known as 11, 23 different types of cysteine proteins. And the one which is important to us is the cysteine protein 39. It plays an important role in the pathogenicity of the parasite. Now, this CP39, it is present in vaginal secretion in patient with trichomoniasis. So, this is usually found in the secretion. So the optimal temperature is around 37 degrees, which is close to the normal body temperature range, and pH is somewhere between 3.6 to 7. It obviously causes tissue damage, and, plays an important role in parasite survival and immune invasion by degrading hemoglobin and immunoglobulins, indicative that CP39 plays the role in trichomonal infection. So this is an enzyme. So whenever there is a discussion about trichomoniasis, we should be having a knowledge about CP39. It's an important enzyme for establishment of this infection. Now, what are the signs and symptoms? In females, this is urethritis, vaginitis, and cervicitis, inflammation of vaginal canal, vulvar itching leading to edema, tenderness and chaffing redness, yellow and green foul smelling discharge may be found, painful urination, there is dysuria, pain during intercourse, that is dyspareunia, punctuate hemorrhage in the cervix known as propitis muscularis or strawberry colored. In males, there is white discharge, although rare. Pain and burning during maturation could be found, that is during urination is found. Complications in women, pelvic inflammatory disease is the most common and important complication. Pregnant women infected with Trichomonas vaginatis is likely to have premature rupture of membrane. This PROM is premature rupture of membrane. Also, premature birth, preterm or low birth weight of the baby. In man, we will find different infections of the reproductive tract like epididymitis and urethral stricture, and also in cases infertility due to destruction of the sperms due to the acidic medium created by this Trichomonas vaginalis may be responsible for infertility. Now about the laboratory diagnosis, direct detection, culture, antigen detection and nucleic acid detection techniques may be used. So how do we do the direct detection? Obviously, we'll have a vaginal discharge or endocervical specimen. We can take a swab out of it. They are not used to run a wet mount preparation because small number of parasites can be collected for culture. In man, urethral discharge, prostatic fluid, early morning, first void urine, urethral swab before avoiding urine, and semen may be collected. So culture of urethral scraping is an effective method for. Obviously, the gold standard or the definitive diagnosis is the culture. It's the most sensitive method. It's, in 80% of more cases, we find this to be accurate. So what do you do with the specimen or the swab that we have collected? We inoculate it immediately into an appropriate medium like modified Diamond's medium, Trichosil Hollander's medium, Trussell Johnson medium, trypticase serum medium. Culture after inoculation are incubated aerobically. So to remind you, this particular parasite is showing facultative anaerobic respiration, but here we do keep it in an aerobic medium. In a positive culture, actively motile stropozoites are demonstrated after 48 hours of incubation at 37 degrees Celsius. New culture system in pouch Trichomonas vaginalis and system of Empirine diagnostic is commercially available and allow direct inoculation, transport in culture and microscopy. These are some new techniques that are used. We can also go for antigen detection by ELISA rapid test, IAF, IAH, and Trichomonas rapid test and Xenostrips test. Although these serological testing will only give you a suggestion of certain type of antigen present, but it's not definitive that it will land you up to the definite diagnosis of Trichomonas vaginalis. Molecular diagnosis, DNA probes may be used. Uh, that is, a DNA direct probe test is three most common syndromes associated with vaginal discharge that we have discussed is Gardnerella vaginalis, Candida albicans, and Trichomoniasis. So we can find out which particular DNA is involved in that discharge, and we can rule out from these three organisms. So this can also be used. Other methods is vaginal pH is usually above 4.5 in trichomoniasis, bacterial vaginosis, but not in candidiasis. Vaginal pH is measured by nitrogen paper method. So you can rule out that it's not fungal infection by measuring the pH. There is also a whiff test or amine odor test in which trichomoniasis bacterial vaginosis vaginal swab is taken and it's dipped into 10% of potassium hydroxide for presence of polyamines. In presence of trichomoniasis, a fishy odor is released due to production of amines. This is also one of the tests that can suggest to that trichomoniasis is present. Now, about the treatment, um, metronidazole is used, and intravaginal clotrimazole may also be used. Here, one thing to be noted is that we have to treat both the partners that is sexually involved in the female and also the male. And prevention, for know us, the prevention is also important. That is, we have to maintain personal hygiene. Barrier precaution, it is using condoms during intercourse might help in stopping the transmission from one partner to another. Avoidance of sexual contact with infected partner is suggested, and detection and treatment of cases either male and female. As such, there is no vaccination available, so don't have a prevention that we just have a treatment if we have an established symptom associated with trichomoniasis, then we can treat them with a line treatment like in parasite metronidazole is used. Okay, that's it. Thank you.